We just don't have the means. And we are not so sick, or, we'll see what happens, but we're not going for the test. So those figures are completely incorrect.
Absolutely.
Now, what does that happen? Less beds, more people, bring us to what we're doing now. A lot of doctors have then decided to treat people at home, but with home oxygen concentrators, because people just don't want to go to the hospital. They're scared because in the second wave, they saw not so much in your problems, but in Eastern Cape, they were dying in the car park, in the cars, in the casualty, in the ambulances. And people have heard those stories, and it's a very lonely place to be in hospital, with COVID-19 all alone. It's very isolated, no family members. So people are tired of driving from hospital to hospital to hospital to find a bed. Casualties are full, the hospitals are full, there's no space, they wait for hours, and they're sent home. So indirectly, without consulting each other, the patients took a decision they're not going to hospital, and the doctors decided they're tired of holding for beds in the hospital. It's not serving any purpose, they can't get done. So everybody started taking oxygen concentrators. And then it happened, now that the doctors who are really committed are going to the patients' houses and trying to sort them out. But you can wait for 1, 2, 4, 5. But when it starts becoming 20 and 50 and 100, it's just not practical. You're losing time. So the LANS community, Dr. Fatima Lambert, called me 2 weeks ago and she said, look, we need a facility. So the first question I asked Fatima is, who's going to be there after 5?
Right.
Do you guys have enough doctors, committed nurses and all to do this? Because after 5 o'clock, you can't tell the patient, you know what, at 5 o'clock your disease will settle, it will start again tomorrow morning.
Right.
That's not going to happen. What's going to happen to the patient? And then, she was amazing. She got together with all our doctors there and people in LANS. And within 2 days, she came back. She said, look, I have 23 conditions. And she said, we can fulfill all of them.
And what were those conditions, doctor?
Oh, it's a long story. Number one is, basically, you have to get us a facility that can be totally isolated. It can be very secure, 24-hour security, no walk-ins, full cooperation from the people there. 24-hour hospital patients, medical staff available, availability of getting all the machines, the beds, community buying. It's a whole list of things, and she fulfilled the whole stuff. And then we said, okay, when she told me that on Thursday, on Friday, we send the beds in. We're sending all the equipment that they require. The medical staff got together, and people have to understand that this is not a hospital. They come at your own risk because you're coming at your own because it's just a temporary disaster intervention. It is a disaster response. But what was amazing was the response from the community. People wanted to bring things in. People want to support, bring money, put things inside. And then people phoned and said, look, we don't mind washing the patients in the hospital. We don't mind coming to take care of them and bring them food. So we said, that's not an old patient. Let's go with it. They said, we know, but we still want to do it.
Wow.
Now, that's the kind of commitment. So, inshallah, what the efforts and all hats to the medical healthcare workers in Indonesia and to the people of Indonesia. This thing can't happen without community participation. And Nur-Ul-Islaam, thank you very much for giving us that all. And everybody was involved in making things, the lawyers, the doctors, the people. It's a facility we open today. It will be by referral only. The community needs to understand that. It's by referral only. It's not a walk-in center. But a criteria prepared by GPs or physicians or intensivers will tell us, okay, these are the sick people, and you put them on the list, and the most sick one comes in first. So you give an opportunity for the sickest one to come in first, and the one not so sick, to come in later.
Right.
If we fail with the 5 liter and the 10 liter and the other things that we're doing there, then of course we're trying to make arrangements, but there's a hospital that have the more upgraded oxygen facilities and ICU care to move the patients there. But with early intervention, hopefully with the right amount of oxygen and supervision, hopefully we'll try to get as many people sorted out inside the facility so you don't have to go anywhere else. The medicine is not static. Things don't follow what they're supposed to follow. So it may be that some will have to go to another hospital, but at least it's a step between sitting at home and getting to a facility, a much higher level of care to try to prevent you from going to hospital.
Alhamdulillah. How many patients would you be able to house at any one time?
20. We don't have more than that because the moment you start having more, the biggest challenge in this country is availability of staff.
Right.
And you get complicated cases there. And then, of course, we are trying to bring some of our own oxygen. We're busy with that to try to get additional oxygen on a temporary basis so we can help 5 or 6 critically ill patients inside the facility. And we've got the machines to do that. But I'm just negotiating with oxygen companies because we even get option, but it won't be enough time for us to get machines that will generate their own oxygen.
Right.
So that's an expensive business, but we are looking in case, for another wave or for future interventions. But 20 patients at any one time, The other thing I need to stress to the people of Lenasia and around who are coming, although this is in a mosque hall, it is a Nur-Ul-Islaam Center, this is not for Muslims. It's for all people. Any sick human being of any race, any religion, any color, anybody who's ill, the facility is open, everybody. Please feel most welcome to come there. Don't feel out of place. Don't feel scared. Don't feel, that you can't come there. It's for humanity. It's open to everybody. Everybody's going to be treated equally. There's no issue. You're sick, you get seen, and that's the condition. And of course, all the healthcare work professionals see patients from all races. So we need the public to understand it's in the mosque. It doesn't mean you're not welcome.
Absolutely. Alhamdulillah for that. I need to ask you a few questions. I'm going to digress a bit, but I have no doubt that you would have the answers for me. We are hearing stories about shortages of oxygen. It seems to be quite a dire need. You've suggested that, you'd get your own machines to pump your own oxygen to your own oxygen. What's the situation there with the shortage of oxygen? Is it something we need to be concerned about?
There's no shortage of oxygen currently because we're not using the oxygen requirements right now. As I mentioned, the hospitals are not having the total capacity of patients that we had in the first and the second wave. So the hospitals are not that full. The hospitals are full, but they're not full with that many COVID patients as we've had previously. So that's the one issue. Secondly, the oxygen, there's sort of a breather for the oxygen companies.
Okay, you're breaking up. You're breaking up, Dr. Imtiaz. Can you just move around? I didn't hear that.
Yeah. Can you hear me now?
Yes, I can.
No, the oxygen companies are not fully stretched yet because a big hospital, Shad Makeke, hasn't got its full complement of 400 patients, COVID patients. So remember, that's some break, it's some respite. Although we need to have that hospital fully functional. So in terms of oxygen requirements, the companies can't manage because there's also only one province that's been badly hit. So it's not like so many provinces hit at the same time. Every hospital by now has installed, most of them have put in bulk oxygen capacity. So I haven't had any complaints of any hospital running out of oxygen, because they haven't taken that amount of COVID patients yet. Although there's a lot of COVID patients in all hospitals collectively, but I haven't, and most of the hospitals have prepared from the second wave to have some extra oxygen. So I don't think that's the issue. The issue is the lack of availability of beds and people not wanting to go to a hospital. Okay. So what there is a lack of oxygen concentrators. Because when you speak to the different groups, even our oxygen concentrators, we say, but you had so many. They tell you, yes, I had 140, we had 50, we had 70, we had 30. All those are out, and there's demands for hundreds more. So there's a huge requirement for oxygen concentrators. The good thing about that is it doesn't require oxygen. It makes its own oxygen. So, so that helps a lot. So right now in Gauteng, I haven't heard any complaints from any facility. Like yesterday, a doctor called me, the CPAP machines that Solidarity Fund has provided us with. They cost 12,500 each. And we delivered 2,500 in December last year, in 10 days to 6 provinces. I got a request yesterday for 200 machines for Joburg alone. And I asked the guy, what about oxygen? They said the hospital got enough capacity to deal with those 200 machines. 2 different hospitals, there's enough capacity. Oxygen is not an issue. But there's no patients. We can't put patients because we don't have the machines. Now, the moment we put the machines, they have the beds, they have the patients, but they have the oxygen to run through those machines.
Do you see the situation improving at any point? And also, I'm sure you've come across this information already. We're hearing noises about a new strain called Lambda. It seems to have appeared in South America, and we know that in a short space of time, it can start spreading all around the world. And the report is also suggesting that it's totally resistant to vaccines. What do you know about it?
It's already in South Africa.
Oh,
it's from Peru. It's already in South Africa. It's from Peru. It's already in 35 countries. And it's spreading in South Africa. The Delta is still the dominant one, but of course it still has to do genome typing, so we're not sure yet. In terms of vaccine resistance, we don't know yet. Even they say that the Delta variant is sensitive to some of the vaccines. We're not really going to know until people who've taken the vaccine, because the vaccine is not a guaranteed safeguard against infection. They say it can protect you from getting critically ill and from dying or from hospitalization. We're only going to know that if people have been vaccinated get either. Until then, it's just a guess game. We're not sure. All in other parts of the world, they say it has worked. But let's see. And remember, even when the strain comes, there is some variation in the strain itself. And
Dr. Imtiaz, I lost you there again, Marth. I lost you there again.
Yes, sorry, the network keeps dropping here. Can you hear me?
Yeah, I can hear you now. Did you just want to repeat what you said just now?
I said, with different strains.
No, I'm losing you again. All right.
Oh, sorry, the network is very bad.
All right, carry on. Yeah, I can hear you now.
I said, even within existing strains, without new strains, those strains can also mutate. And so when you ask how's what the chance looking like, so that is in our hands because the virus spreads and mutates if it has a new host all the time. And the only way to get a new host is to catch on to somebody else who's not sick and gets its body and it can mutate. And the only way is to prevent contact. And the only way to prevent contact is to make sure we take all precautions. The number one, the most effective precaution is to avoid people.
Right.
That's the most effective precaution. And then, of course, when you go out, it doesn't mean it's a death sentence or, it's like solitary confinement that you've got to stop living. You don't have to do that. You can go shopping because the economy needs to turn. It needs to run. People need to earn. They need to survive. They've got spouses. They've got children. They've got families to feed. So we should encourage, and I'm saying this, spend altruistically. And without, giving people a donation. It's about turning the economy, spending carefully, supporting businesses, home industries, people. But when you go, wear your mask, make sure that when you're in the shop, you and all other customers take care of each other. Make sure there's nobody in front of you, behind you, on the distance, or not even the one is better. Just when you stay in the queue, don't be impatient. Keep the distance. 3 to 4 extra minutes is better than spending 6 weeks in a hospital.
Absolutely.
So do that. And the other thing, people still want to do baby shower and I think, what do you call it, wedding shower or bridal shower.
Oh.
And all those kind of things.
Yeah.
And the government says restrict to 50.
Right.
Restrict it to, don't go.
Right.
Just don't do it. And if you celebrate your body 2 months later, the whole world knows we're in a pandemic. It delayed in the wedding, the functions, or then you can't have the gathering a little later. How many weddings I've seen where the husband and wife, the couple got either with COVID, and 300 to 400 people attended got either. So you don't want people to remember your wedding is when they got sick. So let's just avoid it for a few weeks, and the faster we avoid it, the faster the wave will pass.
All right. I need to ask you 1 or 2 more questions before we wrap up. I do appreciate your very, very valuable time, but what you are sharing with us is so very important. Pregnant women and guarding against COVID, what are the risks? Are there greater risk for baby perhaps being born with COVID, whether they are infected or not?
That's your question. I prefer you get a virologist to answer. You know what? They're saying that it's pregnant before there was a risk. There were different fields of thinking. In the very beginning, they said pregnant people can't take a virus, a vaccine. And then afterwards, they said, look, it's better to take the vaccine because there's fetus are aborted and pregnant people get more ill during COVID infection. So it's better to take a vaccine. And then the decision was in which trimester to take the vaccine. So the information changes all the time. You need a biology specialist to give you that answer.
Okay. I shared this information on my show yesterday, and I'm going to ask you as a medical doctor as well, your thoughts in terms of the pandemic, the current situation we're living in. The new health secretary in the UK has made a statement a few days ago saying that we have to accept the reality that COVID's going to be with us for a very, very long time, much like the flu. And we possibly are going to have to get vaccinated year on year, much like the flu. Your thoughts?
That's very likely. That's very likely because you get vaccinated for flu every year. But the thing is, not everybody takes the flu vaccine. The flu vaccine, we say diabetic people, people who go for kidney dialysis, elderly people with chronic infections, lung infections. It's certain categories of people. But look, everybody doesn't take the flu vaccine every year.
Mm.
And the problem with that is you take the vaccine and when by the time the flu comes here, the strain has changed.
Right.
It's not the strain that you took the vaccine for. So that's not really a big thing. You know, people take the flu vaccine. What's important is that once the virus does not have much of a host and there's not many mutations, and we start building our own antibodies either to the vaccine itself or to getting infection itself, then I don't think it's going to be a major problem. You know, and right now we can prevent again what anybody as scientists are saying all over the world. We can prevent that from happening again during different waves to take precautions that the virus doesn't spread. And if it doesn't spread, it doesn't have a host to mutate. And if it doesn't mutate, it can't cause even more serious. All mutations don't necessarily cause more serious infections. But if it mutates in a way to cause become more aggressive and more transmissible, it can cause severe infection. So in time, you know what, it's a phase. As a virologist, I can say it'll take 2 or 3 years, but hopefully by that time it won't be as aggressive as it is now.
Inshallah, we look forward to that time. Jazakallah so much for your very valuable time. Continue doing the amazing work that you are doing. You are such a role model to not only our ummah, but to the world at large. May Allah subhanahu wa ta'ala accept all of your efforts and grant you good health and long life. Assalamu alaikum to you.
Jazakallah. Wa alaikum salam wa rahmatullah.
That was Dr. Imtiaz Sooliman talking about the opening of